Hello friends, in our health number series, we have talked about the numbers in your mouth, the numbers for diabetes, and also the numbers for your oxygen levels. Which means now it's time for the numbers for blood pressure levels, which also tells a lot about your health. Before we start our numbers, let's look what is the blood pressure. Literally, the definition of pressure in Google is continuous physical force exerted on and against an object by something in contact with it. So the blood pressure means the amount of force exerted by blood on the blood vessels, through which the blood itself travels. Now let's get straight to the point. We can measure two types of blood pressure, the systolic, the upper number, and diastolic, the lower number. Simply, the systolic happens when the heart beats and it pumps the blood through the blood vessel, so it appears higher than the diastolic, which shows the pressure between the heartbeat when the heart rests, so it is obviously lower. So the normal or ideal values for systolic blood pressure is between 90 to 120 mm mercury. If it is above 120 mm mercury, then it is considered elevated, and if it is below 90, then it is considered lower. And also the normal values for diastolic blood pressure is between 60 to 80 mm mercury. Above or below that level is considered abnormal. For example, if your measured blood pressure is 110/70, then you have a systolic pressure of 110 and diastolic pressure of 70. You might have noticed the difference between them. It is called the pulse pressure, the pressure difference between your systolic and diastolic blood pressure, which normal level is between 40 to 60. It is also an important indicator for many conditions like atherosclerosis, stiffening of your blood arteries, and many others. Our example had a pulse pressure of 40, so it is normal.
Okay.
The most common disease of blood pressure is hypertension or high blood pressure, which can be diagnosed by your BP levels. So, the systolic pressure of 130 to 139 mm mercury and diastolic pressure of 80 to 89 mm mercury is indicating that stage 1 hypertension. Whereas in the stage 2 hypertension, you will have a systolic pressure of 140 or higher and diastolic pressure of 90 or higher. And there is a last stage called hypertensive crisis, which levels are at whopping higher than 180/120 of blood pressure. As such, you should seek immediate help. Sometimes hypertension can also occur individually, like isolated systolic hypertension, where the systolic pressure is elevated and the diastolic pressure is normal. The same thing goes along with isolated diastolic hypertension. These kind of hypertension are more common in older adults. Hypertension is a serious condition because it can cause damage to your heart, brain, and many other organs. However, don't stress out when you see your blood pressure rise suddenly.
Why are you running?
Because blood pressure is affected by many physiologic factors and your lifestyle like your foods do, so it cannot be diagnosed with only one-time measurement. Measure your BP regularly, although not too often. Ask your doctor how often should you measure, and then if the measurements are higher for a little long, go to the doctor and explain it. With today's modern health infrastructure, you can even control it without medications. It just depends on your levels. So share this video to the others and be part of my healthy league. And comment down below your experience with blood pressure. And I'll see you guys around.